Some additional ways to correct rotation are the use of power chains, which we showed you quite a bit of these. Use of power chains on both the buccal and the lingual, like we did in that overjet reduction case, or the use of rotation ties. Power chain, how many times have we shown you go from the anchor tooth to the target tooth and rotate it to correct it? Okay, very quick, very easy way to rotate teeth. Okay, again, just take that power chain, O-rings linked in a chain, and we can use them not only to close spaces, but also to rotate teeth. And don't forget, those terminal teeth can rotate. If you're doing a canine to canine space closure, those canines can rotate mesially on you, right? Ask yourself, do you want that to happen? If you do, by all means, tie on all 4 tie wings. If you do not want that to happen, go ahead and just tie on the 2 mesial wings. That will help prevent unwanted rotation while you're closing spaces. And don't forget about our power chain anchor teeth, the canines and molars. The anchor teeth are less likely to rotate when you tie on just one proximal wing, or in the case of the molar, just on the molar hook instead of around the entire tube. And nothing corrects those mesially rotated lower bicuspids or upper bicuspids faster than going from the anchor tooth molar to the target tooth. And again, you can use these on anterior teeth as well. Just visualize, it's going to go towards the anchor tooth, right? So you just know which side to pull from. Do you pull from, the right canine to correct the lateral, or do you go from the left canine? Whichever one you need to get the job done. It's always going to derotate towards the anchor tooth. You can also place power chains on both the facial and the lingual to really rotate teeth quickly. In this case, we have a very rotated second premolar. We've placed some buttons on those teeth. Again, a button is just like a bracket without a slot, just used to secure power chains and elastics. So we placed one on the buccal and lingual of that second bicuspid, and we placed one on the lingual of the first molar. And you see how I placed that one on the molar more to the mesial? That's analogous to placing it on just the hook to prevent unwanted rotation of that. And I placed 2 2-unit power chains. Now what I would have done differently today is I would have gone up to the canine, okay, on the facial with my power chain. But you see how just in one visit we were able to rotate that second bicuspid enough where now I can remove the facial button and bond a bracket and get my wire to it and finish up the job. And if I wanted, I could keep the palatal or lingual side buttons, do another 2-unit chain, and just keep working on it from both dimensions. So that tooth's going to be, rotated in no time. And I showed you this in the overjet reduction case. Just again, visualize how chain is pulling and know that you can use brackets and buttons as needed, and you can correct just about anything if you just think yourself through it, okay? Visualize how the chain's pulling. How's it going to help me, kill 2, 3, 4 birds with that one stone?
To make sure you don't miss any of our Powerprox pointers, please subscribe at 6monthbraces.com/orthotips. To learn more about our live seminars for Powerprox 6-month braces, please visit 6monthbraces.com/live seminars. To learn more about our unlimited case support and online seminars, please visit 6monthbraces.com/online seminars. If you prefer to call us, our phone number is 440-646-1000. To learn more about our laboratory services for Powerprox 6-month braces, which include digital bracket placement, 3D printed indirect bracket bonding trays, digital case setups and treatment simulation images so you and your patients can both see the case results before you even start, IPR guides so you know the exact amount and location of any IPR that you may need, and a lot more, please visit 6monthbraces.com/Powerprox Lab.